Hello, my name is Siobhan Seaman. I'm one of the consultants on the inpatient unit here at the hospice. And I suppose our role as doctors here is to work very closely with our nursing colleagues and the rest of the clinical team to deliver the best possible holistic care that we can for all of our patients. There is no doubt that the Covid-19 pandemic has made us think differently and have to adapt to how we deliver care here at the hospice. One of those changes has been the requirement to use personal protective equipment, or PPE. So all staff entering the clinical area will always be wearing the government recommended PPE. That's a mask, a visor, apron and gloves. Overnight and at weekends, there isn't a doctor based in the building, but there is always a doctor on call who would come back in to review any patient if requested to do so by the nursing staff.
Hi, my name's Holly. I'm one of the nurses that works here in Marie Curie in Penarth in the inpatient unit. Currently, this is a difficult time for both the patients, families and staff. We plan and provide care that meets every needs of the patients here. We liaise with family support team on a daily basis to give them updates so they can then relay back to the families at home. We actively encourage families to get in contact with us and to keep in contact with us so we can give you updates, and we are all here for your loved ones.
My name is Jo and I'm part of the family support team at the hospice here in Penarth. Part of my role is to provide emotional support to patients and their families. Things are looking very different at the moment, and for both patients and their relatives, not being able to have visitors is really difficult. Myself and my colleagues Terry and Claire will offer daily phone calls to relatives, just so you know how your loved one has been, or if you wanted to pass on any messages between yourselves. If there are any medical updates, then one of the doctors or the nursing team will contact you. A large part of the service we offer at the hospice is providing emotional support to patients and family members. This also includes any children or young members of the family. Normally, we provide this face-to-face. However, due to the current restrictions, this is being done over the phone. This support is still available, however, and we can make individual appointments with you to do this.
My name's Claire. I'm the spiritual care coordinator at the hospice. I'm part of the patient family support team, so I'm one of the team who will be contacting you every day with an update on how your loved one is doing while they're with us at the hospice. My job here is both emotional and spiritual. It's my job to work out if our patients have any spiritual or religious needs and help them to find a way to express themselves while they're with us, so perhaps helping them to access religious literature like Bibles or Qurans, and during this interesting time with the virus, also maybe accessing religious services online, or finding a way to make sure that their religious needs are being met while they're with us. I also am able to provide emotional support, so if you or any of our patients have any questions about funerals, what happens when someone dies, or what we can expect from this next season, then I'm here to answer any of your questions.
I'm Sian. I'm one of the occupational therapists working here at Marie Curie Hospice. My role is to help identify what's important to people and support them to achieve their goals. For some people, this might be sitting out in a chair for an hour, and for others, it might be returning home and getting their garden using a wheelchair. We recognise that everybody's unique, and we work closely with patients and their loved ones to improve their quality of life.
My role traditionally has been helping patients to increase their strength and, where possible, their mobility, and just generally improve their overall function and hopefully improve their quality of life. I tend to work very closely with the occupational therapists to help patients to achieve their goals, particularly if that involves going home. With the Covid-19 pandemic restricting visitors, we've taken on a new role, which is to try and help loved ones keep in touch. So As such, we can facilitate video calls between loved ones and help them see each other despite the current situation.
Hello, my name is Steve Jones. I'm the head chef here at the Hospice in Penarth. Our aim from the culinary department is to try to give the patients a restaurant type experience with our food and drink. We look very closely at their dietary requirements and any allergens they may have, and we incorporate that into their menu plan and meal planning. Should they want something that we don't currently provide, we will actually go out and procure anything that these guys want for either lunch or dinner.